Losing weight can be a very exciting thing, and for many, a lot of hard work. But for some, the excitement diminishes after realizing that they are left with a lot of excess skin. Dr. James Nachbar, he has helped many people with this problem, and he is joining us this morning to talk about some of the options. We want to warn some of you guys that the images may be a little bit mature for our audience, so just keep an eye out for that if you have small children. Welcome back to Sonoran Living.
Thank you, Andy.
So a lot of people, they are overweight, they do all of that hard work, they lose the weight, but only to be a little bit less excited because they've got the what do you call that, the wings?
Something like that, yes. Well, obviously weight loss is a huge benefit for people, and with some of the new techniques with surgery and also non-surgical techniques, people are losing a lot of weight, often changing their health. They can stop blood pressure medications often, or diabetic medications, insulin and so forth, but it does lead to some disappointment with the loose skin, and so that's where we can really do some things to help them.
And you're talking about major weight loss. How much weight are we talking about?
Well, some of these people have lost half their weight. I'll get people to come in and have lost 200 pounds or smaller, less than half their current weight. Other people have lost only 40 or 50 pounds, and even with smaller weights, weight losses will sometimes get loose skin. So we can help all of them.
How are they losing so much weight with all of the new diets and stuff out there? And
well, some of it is with the gastric bypasses, and a number of that's a whole class of procedures that are helpful. Also, some of the hormonal treatments. We have a better understanding of nutrition and so forth. A lot of people just exercise more, eat less and exercise more. The 5-word diet weight loss regimen is also a way that people lose a lot of weight.
Can people that are losing small amounts of weight, can they benefit from this treatment as well?
Sure. Obviously, every procedure is customized. So if someone's lost a small amount of weight, we talked before about after baby issues as well.
Right.
You can have a little bit of loose skin. Some of those people need a lot less surgery. They might just need a little bit of liposuction or a little bit of a smaller resection or smaller tissue removal. Other people that will have lost a lot of weight will need a bigger procedure to help them.
Well, I think we can all look at ourselves and find places that we'd like to do a little nip tuck. But specifically for this segment, we are talking about excess weight. Let's go ahead and look at some before and after pictures.
Sure.
Because then you can sort of show us what you're talking about and what our choices are.
So we have a range of pictures here, and many of these are on our website. But obviously this patient's lost a lot of weight, and so there's loose hanging tissue around the tummy area. And this is the patient we've tightened up all the way around. We've tightened the tissue on the side, tightened the tissue in the front, and so we can get rid of a lot of that loose tissue that gets in the way of actually walking around. You can imagine how that tissue makes it harder to exercise, harder to continue to lose weight. Plus, seeing all that there is very, it hurts your morale as you're trying to work hard and lose the weight. And so by getting rid of that tissue, we can make a big improvement. Here, we're actually tightening up the back, which we do with a circumferential abdominoplasty. So this is a nice way to tighten that area there. You can see the hip area as well as the back side has been tightened, and even down into the thighs.
And we were talking sort of about the scarring, but like you said, when you lose that much weight, that scar is not a big deal.
Right, none of these patients complain about the scar just because of the huge amount of improvement we can get. See here, you can get the sides, we can make the sides better as well as the front. So you can see that'd be a huge benefit for this patient.
Well, as we're looking through some more pictures, when do you think the best time is for patients to come in for a consultation? Before they've lost the weight, in the middle, after?
Well, really, as soon as they realize that this is something they're going to want to deal with, I would say that's a good time, because we can lay out all the options. A lot of patients will have not lost the weight yet, and doing the surgery will help their motivation, help them lose weight. Okay,
let's keep going through the pictures. I think a lot of us remember, going to school and having teachers.
Right, the bat wing thing there. So this picture here actually is a gentleman who lost a lot of weight, plus had the surgery to tighten his tummy, and then just worked out really hard. So this is the kind of change that is real, that's a real patient, and really is practical for people to just make a huge change in their overall health.
Yeah, I guess we should mention that it's not just for women. I just always think that the women are the ones that get this done, but men as well.
We have a lot of men that have this type of surgery, and who work really hard and lose weight, and they do well. So this is the arm situation, where you've got the hanging tissue there. We'll do what's called a brachioplasty, where we tighten the skin, usually from the front, because that's where the scar is the most hidden. You can see we can get rid of some of that loose skin that's hanging there. If someone's lost a lot of weight, we can sometimes tighten up their chest skin as well, and even connect this with the chest excision to tighten up the whole back area as well.
Wow, amazing. It's amazing.
So, and often these procedures will combine them, so that it works really well to do several things at once. They can get a lot of benefit. And so, again, to go to our website is where I would suggest that people can see some of these patients.
Real quick, is it something you could have done all in one visit, or do you go in for the arms and you go in for the tummy, you sort of do it step by step?
We usually combine the procedures.
Okay.
Often people will have so many areas we can't do everything at once, but we can usually do several different areas. We can do the no-drain tummy tuck to tighten the front and the back. We can do chest surgery, for instance, or we can do the arm surgery, or we can do the thigh surgery. We probably can't do everything that someone who's lost, 300 pounds needs in one surgery.
They wouldn't be able to walk for a little while.
Yeah, but we can do quite a bit.
Okay, great. Well, impressive work. I think it's really fascinating to see all the pictures. Let's go ahead and let you know how you can get a hold of Dr. James Nachbar. His phone number is 480-289-5300, Scottsdale Plastic Surgery. And you can go to their website. It's really easy to remember, and that is plastic.org. And they'll have a lot more pictures and a lot more information there.